My name is David Odhiambo. I'm the chairperson of the Maternal and Newborn Health Coalition of Kenya, which is a coalition working to promote and advocate maternal and neonatal health care within Nairobi County. As a coalition, we've been in the forefront approaching decision makers, having breakfast meeting with the decision makers, even having courtesy visits with the decision makers. At first, when we entered into the coalition, we didn't have a deep understanding, for example, of what advocacy entails, how to engage decision makers, which kind of advocacy tools to use when engaging decision makers so as to influence change. And I can confidently say that right now, we are better equipped. We have got, we know we've got advocacy and communication skills, and we've even took it a notch higher in terms of we know how to develop most of these advocacy tools. Like, for example, talk of evidence brief. We ourselves right now as a coalition, we know how we can navigate. We can navigate into the Kenya Health Information System, that is the DHIS, mine this data, analyze this data, visualize this data, and of course, as a coalition now, we've embedded these advocacy tools in our area of work.
As a coalition, for sustainability purposes, we have taken it upon ourselves to learn. Within us, there are people who are trained on these advocacy processes and tools. And the good thing about it, we're able to train ourselves. So what we've done as a coalition is to ensure that those who are trained in these particular areas are able to train back the other members and cascade the same information so that it remains within the coalition.
Sustainability is a matter of whereby people are in a position to do things for themselves without the dependency of different individuals or organizations. So they're in a position to do things and ensure that what they are doing will last. It's not one-off. And for example, if the stakeholders are able to build relationships that will last longer and also bring more other partners on board. So currently what I can say as a coalition, the sustainability framework for us has worked well for us because we are looking into engaging differently. For example, ownership of the project. We're having the coalition members do things for themselves. We are having us, the coalition, initiating these discussion meetings, going for these office meetings and presenting ourselves to the decision makers. The coalition has a sustainability framework, and since then we've been able to do different things. So the first one is ensuring that we are officially engaging ourselves formally. So we started the process of registration, and the process is ongoing. That is one for sustainability. And then also another thing, ownership, engaging everyone in the process, and then having the different required documents for operation.
Trainer of trainers approach in our coalition, it was all about the coalition owning what they really want. Because in an essence, we saw that when at one point, these partners will move out. What will be our moving on? As one of the TOTs, I liked the aspect of me doing it.
Working as a coalition, it's very important because you'll synergize your efforts. Because for us, working as a coalition has been very imperative in terms of we've been able to consolidate all our efforts, all our strengths together. At first, it was very difficult, but what I can urge people who want to form coalition out there is that forming a coalition basically is the better way to amplify your voices. Like for us, it has been very easy to amplify our voices as far as maternal and neonatal health care is concerned within Nairobi County, because each and every organization now, we are working as one. We are not working as individual organization. So if there is any agenda which we need to push, like for example, meeting policymakers such as the members of the county assembly, the Nairobi Metropolitan Services. It has been very, very, very easy for us to engage these decision makers because we are engaging them under one entity, under the coalition, of which also it makes them to, when they hear that we are a coalition of grassroots civil society organization, they take us seriously that this is a conglomeration of many voices within the community coming under one consortium to champion for a noble cause. So it's been very easy to get our message out there with the policy makers.